Today is March 29th, 2018. Exactly 1 year from the date of my double jaw advancement surgery to correct sleep apnea. If you're not familiar with the story, I battled sleep apnea for a number of years. I was intolerant of a CPAP device. I had a deviated septum repair and turbinate reduction to repair a fractured nose. I had an implant, or I wore a dental appliance at night to sleep to pull my lower jaw forward, which worked for about 4 or 5 years, and then resulted in messing up my bite when I went to get orthodontia to correct my bite and my teeth. Then the sleep apnea returned. I consulted with an ENT about the Inspire device, which is the implantable device that stimulates your airway while you sleep, kind of like a pacemaker. But because of the level of activity and the number of sports injuries that I've had, it was deemed to be maybe not a good fit because they were not compatible with MRI. Also, it would have been visible through my chest wall because of the size, and then the battery lasts about 10 years, which means I would have probably had to get that thing done 4 to 5 times. So I opted for the double jaw advancement surgery, which was a giant and major ordeal that I wasn't prepared for. I had a significant complication during extubation that resulted in a septal collapse and nasal deformity. That resulted in me having to wait almost 6 months to get my nose repaired, which was done so by a nasal reconstructive with rib graft. Almost all of the challenges that I've had since the double jaw advancement surgery have been related to my nose. Have difficulty breathing because my septum was collapsed. Now, because of the inflammation of the rib graft and the stiffness still that I'm having about 6 months after the surgery, I still have challenges with my nose running, my nose being stuffed up. It is deviated a bit to the left and crooked. It's not quite attached here because of the rib graft peeling away and bowing a bit. So I'm gonna have to get likely another procedure on my nose, a revision to try to fix it. The upper lip is stiff. The area around my nose is stiff. It's difficult to see my upper teeth, although it's getting better. The muscular control is still quite not there because there's just no room with the stiffness of the nose. So hopefully that can get trimmed up a little bit. I have a feeling across my chin here of coming out of Novocaine. That's been numb now and a little bit tingly probably for the last 4 to 5 months. It hasn't changed. Same with my upper lip. So all through this area of my face, which is where there were plates that were removed during the nose surgery, plates and screws, even though they're gone, it still gets swollen in the morning. It still gets swollen during the day. The swelling along my jawline, though, has seemed to have gone away. The control of my lips when I speak and when I eat is getting better. But again, I can't see my upper teeth. And I used to have a very upper teeth smile, and now it's all lower teeth. So my face has definitely changed from that perspective. I would say, though, that overall, I can't even tell you if my quality of life has improved because my sleep has improved, because while my airway is significantly more open, I'm struggling with the nose, and so I'm still even nasally right now as we speak. So I'm likely not sleeping as soundly. If I look at my sleep tracker, I'm restless throughout the night. I rarely have the circadian rhythm patterns where I've got deep sleep multiple times a night. So I have restless sleep most nights, which is not what the desired outcome was. And I'm still having that afternoon crash during the day where I'm tired because I'm not, I guess, resting well enough. I'm hopeful that over time the inflammation in the nose goes away enough that I have a better airway when I breathe through my nose. It freaking better. But I would say that my blood pressure and things that were related to sleep apnea, my body being achy and sore every morning when I wake up, my difficult time recovering from fitness and exercise and playing soccer, that has definitely improved, and I sometimes forget about that, but that was becoming a challenge for me at my age, just because of all the old injuries and not getting rest enough to get good oxygen and blood supply to my muscles, that I was sore every morning and achy, and that's gone away really, really in a significant way. So from that perspective, it's good. I am still, having challenges with the rib graft area, believe it or not. I have this phenomenon if I bend over too much to do any kind of fitness, or if I, even tie shoes and bend over at the waist, my ab muscle on the left side where the rib graft was locks up. I mean, it locks and cramps, which is really odd. Again, to be fair, I have not really done any reconditioning of my core since the nasal reconstructive surgery. It was so uncomfortable in the rib area for the first month or so after the nose surgery that it was like one of those things I just kind of avoided because of the pain. And now I need to really get my core conditioned. It's coming up on the spring. I'll be outside more, indoor training for my soccer club, and my indoor and my speed and agility stuff is subsiding, and now we're going outside. I'm going to start playing more myself outside, which should help. Hopefully that will just be better in time. I've got a bigger commitment to nutrition and fitness right now as well, which will make an impact, I think. My hope is that the core thing and the rib thing is it's a matter of me just not conditioning the muscle again. Hopefully that'll come back. We'll see. But the real issue is that every day, all day, 24/7, 365, well, it's only been 365, but 24/7, I can feel my face. My lower lip, especially when I speak, it gets fatigued still. I can feel my upper lip. It's very difficult to get really good hygiene in the upper lip at the top of my teeth because of it's very crowded, because it's very stiff in my nose. It's still not very pliable. It's getting a bit more pliable every day, but it takes a lot of, massage, and it actually hurts. Like if I press in, I don't know if there's a metal. I'll have to find out when I go back to the plastic surgeon if there's metal in there or if it's just a sharp piece of cartilage. But I've got some places where right here when I press, or right here when I press, it's sharp and it kind of like digs into my face and kind of doesn't feel good. This part is completely detached and it sticks out and it's very noticeable, and I don't like it one bit. So that's gonna have to get fixed or trimmed or something. So I know for a fact I'm gonna have to get another freaking revision surgery on my nose, which sucks, and I'm not looking forward to it. So my hope was that after watching all these videos that I watched and the research that I did, that a year out, I'm like loving life, getting good sleep, well rested, feel good, feel healthy. I expected that the nerves might be a little bit disturbed, which they are, and I would say that I could probably live with it if not for the nose at the same freaking time. My actual teeth, my jaw, my roof of my mouth is still sensitive. On certain foods that I eat, it actually causes pain in my teeth. So that I gotta get figured out. Hopefully it's just time. I swear, if it's like this all the time, it's gonna suck. I plan on living 40 more years or so, and if I gotta deal with this for the next 40 years, it's really, really, really gonna be depressing. So we'll see what happens. But overall, I would give the surgery a C, maybe C+. I was hoping for a better grade because early on, at the speed I recovered and the way my body felt after the first month or so, I was jacked up and excited, and now I'm just really frustrated with the whole nose situation. So year out and not super excited about the results overall. I know that I'm facing another nose procedure, hopefully minor, but that's going to be a setback and it's going to be a recovery. So it'll be longer than a year. The feeling in my face, in the nerves, I'm going to ask. I go back to in 2 weeks I go see both the maxillofacial surgeon, and I see the plastic surgeon, both in the same week. In fact, the same day, to do a 1-year follow-up and a 6-month follow-up, respectively. So I'll find out about the nose. I'll find out about what procedure that will be and the timing of that. And then I'll find out if this is it, that I'm going to have this feeling with my face and the nerves, or if maybe it'll take longer than a year. I really think, though, that if I get the nose thing taken care of and I have more room in my upper lip, I will be much happier. It will be less uncomfortable. And I believe that once the nose becomes a little bit more flexible and more pliable, that it'll be better. Like, I've read that a rib graft reconstruction is about a 12-month total recovery from an inflammation perspective, and I'm only about 6 months from that, so I'm halfway there. I can notice a bit of a difference, so I believe it'll get better. So let's hope so.